So to talk to us today, we have with us today Dr. Shubham Narnoli, an MD Psychiatry from AIIMS Delhi. Dr. Shubham has extensively trained in neuromodulation facility at AIIMS. He is currently the medical director for India operations at Mindful TMS Neurocare. He is passionate for understanding the neural processes and modulating them in order to improve a person's quality of life. So, welcome to Medical Dialogues, Dr. Shubham. It's really a privilege to be having you on board
Thank
here
you
with
so
us
much,
today.
Dr. Nandita. Thanks a lot. It means a lot
Great,
to
great.
me. Yeah.
So we're talking about mental health today. Our main topic of interest is that, and we know that in today's world, a lot of issues are cropping up. So, if I may ask you, what are the most recent breakthroughs in the treatment of major psychiatric disorders like depression and schizophrenia in today's world?
So, Dr. Nandita, there has been a lot of things which is done in the recent past, but there are available conventional medications and counseling as well as psychotherapies for both depression and schizophrenia. But there also have been major revolutionary breakthroughs in the treatment over the past decade or so. So when we talk about these revolutionary breakthroughs, the first and foremost that comes to mind is neuromodulation techniques, which includes RTMS, that is repetitive transcranial magnetic stimulation, transcranial direct current stimulation, vagal nerve stimulation. Also there have been conventional neuromodulation techniques which are always very promising, that is electroconvulsive therapy, specifically for psychiatric indications. Medications that target newer receptor profiles and lead to very few side effects has increased the range of medication classes, because not all meds may work for everyone. So the increase in range of medications is really crucial. So that has been happening a lot. There has been increased use of ketamine for depression, a lot of web and app-based treatment which are available. For example, avatar therapy for auditory hallucinations, visual hallucinations. So there is a lot being done in field of neuro and biofeedback as well, in which the brain waves are regulated. The dysregulated brain waves are again regulated back into their healthier patterns. The list is exhaustive, but increased number of options gives an individual a choice based on the severity and kind of symptoms they suffer from, and also based on which of them is most cost and time effective for them.
Great. Definitely, there are recent breakthroughs that one must be aware and keep them abreast with. Now, if I may talk about precision medicine, how has this, including pharmacogenomics or all these, impacted the psychiatric treatment protocols?
So when we talk about precision medicine means that a particular target is being identified, and that particular target is being targeted in order to improve a person's or a patient's symptoms, right? So when we talk about targets, to identify that target, one needs to have some diagnostic or investigative tests in order to label them as this particular phenotype. So for that, there are a lot of newer modalities which help us to precisely say that, okay, this person is suffering from this particular condition, and for this particular condition, subphenotype of that particular condition, we need to have a particular modality of treatment. So those various modalities could be, functional MRI, EEG, that is the brain waves, eye tracking, speech. So these are various ways in which we can identify a particular person's phenotype. Now, also through genetics, we can do that, and we can say that, okay, this particular kind of a drug may work in this person, may not work. This is the reason why a particular drug is working or not working or a medication is working or not working in a particular individual. So, for example, a person is a very fast metabolizer. Okay, by fast metabolizer, I mean that the medicine inside a person gets finished off very quickly. So that is why it is not being able to work in a fashion it should be. So these fast metabolizers could be identified through various genetic tests, and the dose increment or decrement can be done accordingly. Similarly, receptor expression is something which can be identified with pharmacogenomics. Some individuals express receptors in a different way, and some others in a very different way. So through these receptor expression, a particular gene can be identified why this particular person is expressing a certain receptor or not, and through that we can identify which kind of medications may work or may not work in that particular individual.
Okay, understood. Now, what role do neurostimulation therapy, such as transcranial magnetic stimulation, that is the TMS, or even the electroconvulsive therapy (ECT), all these play in the modern treatment plans?
So ECT has been there for the past 80 years, 70 years or so in psychiatric practice. And it has been time tested and is the most effective way of treating acute, emergent, and a resistant kind of an indication. Having said that, it has its own disadvantages in the form of that anesthesia or sedation is required before a person gets into ECT. And on top of that, it has its own cognitive, that is, memory issues associated with it, right? But TMS is an upcoming treatment or has already, taken over the market in the sense that the acceptability for TMS is quite a lot compared to ECT, and nowadays people are preferring TMS even over medications. So it has created a huge revolution when treatment of psychiatric indications are concerned. So TMS mostly works for people who have mild to moderate kind of conditions. At times, even in patients who are not responding to certain kind of treatments. So what TMS does is that it sends some magnetic pulses into a particular area of the brain which has been shown to be implicated in a particular kind of a disorder, and through by either inhibiting or by exciting whatever is needed, excitation or inhibition, whichever is needed. So through that, the outcome is achieved. And when side effects are concerned, there are minimal to nil side effects. The only thing that needs to be remembered is that a person who has history of seizures in the past may also have an increased risk of seizures with TMS. But apart from that, there are very few minor side effects which can be managed very easily. And the rates of even those minor side effects are very, very less. So it can be considered as a very safe and innovative treatment, and a treatment which is very, very less invasive.
Okay. So now you also mentioned about medications or drug classes. So have they shown a promise in clinical trials for treating mental health conditions?
So there have been recent advancements. So in medications also. So why mental health or psychiatric treatment when medications come into play has been so stigmatized is because of two things. One is because of the level of drowsiness or level of side effects it causes, and the second thing is that people are concerned about dependence, whether they will cause dependence or not. So these are the two things, right? So to minimize both of the things, there have been numerous researches that have been done, and to develop newer drug classes so that it targets both of these concerns which have been present for quite some time. So, for example, there has been a newer drug class.
Also mentioned about medications or drug classes. So have they shown a promise in clinical trials for treating mental health conditions?
So there have been recent advancements. So in medications also. Why mental health or psychiatric treatment when medications come into play has been so stigmatized is because of two things. One is because of the level of drowsiness or level of side effects it causes, and the second thing is that people are concerned about dependence, whether they will cause dependence or not. So these are the two things, right? So to minimize both of the things, there have been numerous researches that have been done, and to develop newer drug classes so that it targets both of these concerns which have been present for quite some time. So, for example, there has been a newer drug class called as orexin antagonists. So these are basically suvorexant, lemborexant, which do not cause dependence, but yet can induce sleep and improve the sleep quality in a person, and can be taken for a very long time without causing dependence, right? There are other therapies, revolutionary therapies, which are happening specifically in schizophrenia. So schizophrenia medications in the past have been known to cause a lot of side effects, metabolic side effects, rigidity, stiffness, and other kinds of symptoms, other kinds of side effects. So nowadays, these kind of medications are being developed in which these particular side effects are being tried to minimize a lot, right? So these are some of the revolutionary things which are being done in developing new drug classes.
Okay. Now we are in the world of digital health. AI getting informed or getting included in even in the healthcare management. Now, how is this digital health technology, AI in mental health care, if I may talk about that specifically, transforming the patient care and well as its outcomes?
So we all know that the demand of mental health has been increasing because the stigma has gone down a lot in the recent past, specifically after COVID time. To meet these demands, not it is not possible for each and every person to have a physical visit, right? So in that sense, digital health is something which has played a crucial role in minimizing that bridge that has been there when mental health care is concerned. So through telepsychiatry platforms, and these telepsychiatry platforms have being used a lot, and especially during the COVID time, and is still being used and has made it very convenient for people to consult any mental health professional. So when AI or artificial intelligence is concerned in mental health care, so through AI platforms, there are various AI platforms in which a person can feed in their symptoms, and it becomes very easy for the person sitting on the other side of the table to understand what exactly is going, because at times there are a lot of things can be missed in an interview. So these AI tools can help a mental health professional to identify exactly what the person is suffering from. Apart from that, there are various machine learning platforms through which it keeps on learning and specifically identifying, or the precision of that particular tool becomes more and more precise. So through that, AI has been doing a lot in the field of mental health care.
Okay, so that advancement, as it is being incorporated in almost all fields now, it is also entered
Correct.
healthcare. Yes.
Correct.
So next part is the advancements in psychedelic assisted therapy. If you can just put a little bit of light on that and its potential therapeutic benefits as well.
Thank you for asking that question. There has been a lot of queries that has been coming up to me from various patients who are there in Delhi and even outside Delhi, and saying that can we do psychedelic assisted therapy or psychedelic treatment for this particular indication or that particular indication. So till now, psychedelic therapy, assisted therapy is not being yet practiced in India, but especially in US, people have found out that in cases which are not responding to conventional treatments, psychedelics, especially psilocybin, a particular compound known as psilocybin, which is derived from some kind of magic mushrooms. So this particular compound is helping psychotherapists in order to assist in resurfacing the traumas of a patient, and to explore those traumas and process those traumas in that particular psychedelic or psilocybin induced state. So in those particular resistant conditions or not responding conditions, this kind of therapy can be used. But having said that, it is not being yet practiced in India, and it needs a lot of research to be done, and a lot of things are yet to be explored in such indications, especially because it is an individualized approach. It cannot be applied to each and every person. So this kind of individualized therapy needs a lot of training, a lot of research, and only after that we can come to know that how it works and in which kind of population it works.
Okay. Now, what efforts are being made to address treatment-resistant psychiatric conditions, and are there any new strategies which are showing success in this field?
So I have already said a lot about this. What kind of strategies are being used in treatment-resistant psychiatric conditions, and so treatment resistance in itself was a very old kind of concept. Nowadays, we are trying to identify why a particular kind of treatment is not working for someone and is working for other people. So there comes the role of precision medicines to identify the targets that needs to be targeted in order to improve the person. New strategies, specifically neuromodulation, that is, transcranial magnetic stimulation, transcranial direct current stimulation, vagal nerve stimulation, and other invasive procedures also. There are newer modalities which are upcoming, that is ultrasound procedures, functional ultrasound. There are kind of light therapies which are coming. There are various kind of psychotherapies, newly developed psychotherapies which are coming. So there are a lot of things that are being done in order to address this particular kind of population.
Okay, that's insightful. Now, Dr. Shubham, lastly, if I may ask about the integration of behavioral therapy and pharmacotherapy, how has this integration evolved with the current research findings? If you can just put a little bit of light on that.
So, whenever we talk about behavioral therapy, we talk about basically psychotherapy, and there are a lot of kinds of behavioral or psychotherapies which are available. So there are not lot of research which is being done when psychotherapy and medications are directly compared, or when combination of psychotherapy and pharmacotherapy is done. And but whatever has been done shows that whenever there is a combination of behavioral therapy and pharmacotherapy, the outcome is always better than either treatment alone, right?